What are the financial considerations involved with the adjuvant therapy decision? I think in evaluating patients for adjuvant therapy in the melanoma arena, we need to consider two things. One, what is their insurance status? Do they have prescription drug coverage? What is their coverage for infusional therapy? These are two really big things that we need to, as healthcare providers, be involved in. These therapies are very expensive and can very much influence which therapy you're going to do. We also need to take into consideration side effects from therapy and patients not being able to work or having to be off work for a period of time, which can also impact their financial status. So these are all things that I think we should be talking with patients about. Prior authorization is an absolute must with any of these therapies in the adjuvant setting, and assuring that we're using these within the guidelines as they are FDA approved to help ensure that they get paid for. The other thing healthcare providers need to be aware of is what a patient's copayment will be. There are multiple foundations and patient assistance programs that can be explored for this. Unfortunately, some of these are not available to patients who are on government-funded insurances, and that needs to be taken into consideration as well. Oftentimes, the co-payments can be what really can be a financial burden for patients. Also considering travel to and from the physician's office. Some patients may have to travel from a long ways away, and we need to consider hotel stays, food, gas, and parking in those. And if there are any assistance programs for those as well, to consider offering those to patients.